Hey, welcome to another video from Skinny Medic. So in this video, I want to talk about when you should be using an airway adjunct, such as an OPA or NPA. Now, I've already done videos on how to place these. Pretty simple, but it does take some training. But one of the questions I get a lot, whether it be in my inbox or classes, is when should you use this? So the simple answer is when the patient cannot cough or swallow. If you ask them to cough and they're able to cough, they don't need an airway adjunct. If you ask them and they don't cough or they can't swallow because they're unconscious, they're just semi-conscious but they're not able to do it, then you should protect their airway. Now, there's some steps you can take by opening up their airway, doing a head tilt chin lift, a jaw thrust maneuver, maybe you just put them in the recovery position, but ultimately they do need an airway. So you can put an NPA in their nose or you can put an OPA which goes in their mouth. So if the patient is not able to cough or swallow, they need their airway protected. So hope this video helps. You never know when you'll be the first responder. Remember the right gear and the right training. Medic. So in this video, I want to talk about when you should be using an OPA. This is an NPA. Unconscious, you probably need to protect their airway. But the simple answer is